Hey guys, I guess you guys are wondering what kind of cheesy shenanigans I'm up to now. Well, you've heard it from me before. As healthcare providers, we don't tend to follow instructions. We'll work and everything. The last few years, I haven't been really following my trainer's workout schedule. And as a result, we've put on a few pounds. And the last few weeks I've been thinking, because I've been struggling to think of topics to kind of bring. And it gave me a bright idea. Why don't I make a vlog, hold myself accountable for the next 6 to 9 months to try to lose a couple pounds, be accountable, and have some talking points. And speaking about accountability, today's first topic will be, what is really our job as a doctor, as a healthcare provider? We'll talk about that in between sets, but let me talk about my personal goals for the next few months. Obviously, I want to lose a few pounds because right now we're struggling to fit into a lot of stuff, including my lifting belt. Look at that. It's supposed to snap on. You know how much weight I lose if this is back on. That'll be at least 10 to 15 pounds, probably closer to 15. But anyway, this home gym means a lot to me, and we'll probably talk about that in one of the vlogs in the future. But one of my favorite lifts is the deadlift. I don't know why, there's just something about that clanging and banging. And the goal for this 6 to 9 months is try to hit 405 again. The max I've ever been able to do with this in terms of deadlift is probably around 415, 420. But that was also like 5-6 years ago, around COVID time. It'll be nice to be able to lose a couple pounds and get back up to at least 4 plates. In workout world, a lot of what we talked about is in plates and 45s. Right now I've got 135 here, 225, and a 25-pound plate here, so that makes it 275. This is my first deadlift in probably at least 7-8 months, and I haven't really done a serious deadlift program in at least 3 to 4 years. Today we're gonna take it a little easy. Normally I like to use chalk, but today we're gonna use some straps because the most important thing is not to get hurt. We'll have some talking points in between. Again, today's talking point is, what do we do as doctors? Since we're already warmed up, let me get the first set in, and then we'll talk afterwards. If you have the space and you like deadlifting, get yourself a deadlift jack. It'll save your back and a lot of jam fingers trying to load the plates. These are straps. Normally I like to use chalk, but being that's human as heck. Oh, we have a waspman here. Let's get this guy out. Hold on, out, and we're back. Normally I like to use chalk, but it's very humid in here right now. It is 85, 82 degrees in my garage. And honestly, mainly because I haven't done a strict program in a while. Straps probably the safest route. And thanks to my favorite trainer, Manny Fusaro, he decided to give me 3 sets of 6 to 8, which is a lot for deadlift in terms of volume. Normally you're doing not 8 reps. We'll see how 275 goes, and depending how we feel, might bump it up. But let's just make sure everything's just going on the correct groove path. All right. Let's talk. Let me grab something to sit on though. Biggest misconceptions as being a doctor is that, or anything in the healthcare field, is that we're here to quote unquote fix people. And people say, well, if I'm going to you, you're not fixing me. What are you really doing? And throughout the years, especially seeing my vision therapy patients, regardless of bringing the kid in with a quote unquote lazy eye, with the eyes drifting out, which I do not like that term, by the way, but that'll be a conversation for a different day. Whether coming post-traumatic brain injury and they're dizzy, light sensitivity, whether they're just having trouble reading and the child is just skipping lines all the time or seeing double while they're reading. What I've learned is that as healthcare providers, with the exception of maybe surgeons, our job is to guide patients. Our job is to relay what we've learned throughout optometry school, throughout medical school, physical therapy school, whatever it is. Our job is to find the right message to get through to that individual. That way we get the proper information we need to get them better. And how I realized this is throughout the years, when I get these patients that complete their vision therapy, or even just with dry eye, where they feel so much better after whatever therapy we do, they always thank me as a provider. And without realizing it throughout the years, I've always said, it's not me that fixed you. It is you that fixed you. It is you as a parent that helped your child get better. It is you as an individual that did the warm compresses, that trusted me throughout the process, that trusted me that when you had significant keratitis in your eye, and I put that amniotic membrane, that you knew that you're on the right path to get better. Our job is to guide. As a result of guiding the patient, if they follow directions the way we want, that's how they get better. And it's taken me years to realize this, even though how I was talking to patients, I was saying that all the time. And it didn't really hit me till probably 3-4 months ago. Well, I had a patient who, for whatever reason, decided to stop therapy years ago. And now we started to become more symptomatic. And literally, he was trying so hard to come in earlier because he was starting to become symptomatic before this big exam. And I can only see so many therapy patients a day. So it was hard to get him in, but he was dying to get in. And he asked me in an email, can I come in earlier? And that's when I realized what our job is as providers. I literally told him, do you think it's fair for you to skip all these people that are dying to come in when you had the opportunity to get better years ago? And that's when I realized throughout these years, my job has not been to fix someone, but to guide them to try to make themselves better. And honestly, that's what we do in healthcare. I haven't moved enough, thank you. And I guess that's why I've been grateful enough throughout the years to have patients trust me, because they understand where I'm coming from. And before I sit here too long and ramble, let me get my second set, and then we'll continue talking. That 275 actually felt really good. Contemplating, do I want to go up a little bit and just do sets of 6 or 7? You know what? Let's do 295 and see how it feels. Normally, when I deadlift, if it was a strict deadlifting program, I'll be doing sets between 3 to 6. But since my trainer loves me so much, I love you, Maddie, he decided to do 3 sets of 8. Sets of 5 and 6 for deadlift feels like a long time. By the way, it is 0-0 into extra time with Spain versus Argentina. Yes, it's still on the background. Let's get the second set in. Get you out of the way. I'll be extremely grateful if I can get 6 really good reps. Yes, I always wear a hoodie when I lift because it traps my sweat. If not, I'll be slipping all over the place right now because I'm sweating like crazy. 9, 3, 2, 1. That last one felt sloppy, but the first 6 was good. In between rep talk, if you read our reviews, and if you're someone that comes to my office or have heard about me, one of the things they'll probably say is, he likes to talk and he's an interesting fella. And he'll probably say some stuff that hopefully will make you click as a patient. So I can't breathe. We all, as healthcare providers, love to see patients. But sometimes we get in this monotonous way of saying stuff that honestly, that spiel might not be clicking for that individual in the chair. And that's something that is very, very hard to know if what you're saying is clicking or not. Obviously, we have those patients where you could talk and you could tell they might have a deer in the headlight look, but they just will not. No matter how many times you ask them, do you have any questions? They won't say anything back. How do you expect me to help you if you're not verbalizing that my point getting across is not there? But a lot of patients, what I've learned is, and I tell this to all my staff, is not what you say. It is what is perceived and what is taken in. And some patients, you could just talk, and probably 55 to 60% of the patients that you talk to, that normal spiel you go through every day, probably gets the point directly across. Some patients, you might have to coddle and baby. Well, you just tell them, it'll be okay, it'll be okay. Some patients, no matter how much you say, it's gonna be a process. They're like, well, I still don't feel better. Well, I told you that. How is it that you get your point across to that individual chair is honestly an art. And I've been grateful enough to have a lot of patients that trust me and have left a lot of glowing reviews. But the reviews I always remember are the ones where they completely bash me. Because those are, I didn't gain that much weight, right? Those are the learning experience that will help me hopefully get my point across to that person that might have similar mindset as that patient that did not like their encounter with me. Some patients, you just gotta lay the boom and tell them, this is how it is. Some patients, you walk the fine line telling them, you're here for me to help you, but it's not gonna happen overnight. And there's nothing wrong with either, as long as what you're trying to do is try to help the patients. I have no problem making myself honestly sometimes look bad to get my point across. If it means it makes it easy for the next doctor to help them, that's perfectly fine. And sometimes we gotta remember, it's a relationship. Not every relationship is gonna be glowing. As long as there's an understanding of, I'm here to help you. And if you read those reviews that, especially if you're patients that do come see me, if you read those reviews of those patients bashing me, you could probably see me saying that kind of stuff, but it's the intent of what I was trying to do to get my point across. I'm not here to collect that copay. We're not here to collect that copay. We have to collect that copay, but that's not the ultimate goal. The ultimate goal is to get that person better. But how do we do that? How do you get the point across? And that takes years of understanding yourself, figuring out what's the best route in terms of communicating to that person. How I communicate is totally different than Dr. Play. It's totally different than Dr. Huynh, totally different from Dr. Sengupta, totally different than most people. But that's fine, because that's what makes me feel comfortable in terms of getting my point across. As long as the patient gets better, that's all that matters to me. Last set, not gonna lie, this has felt much better than expected in terms of lifting. Last set, best set, let's go. Okay, did 8-7, I'll be ecstatic if we get 6. That 7th rep from the last one was sloppy, and then it felt great. If I can get 6 good ones, that means more than 8 bad ones that put my back at risk. 3, 2, 1. Think about that, docs and patients. If someone tells you to take a specific medication to get you better, or that therapist that tells you to do that exercise, or that doctor that tells you to wear those glasses and you don't wear it, or me telling you to do warm compresses and you don't do it, how do you expect to get better? I tell all my patients this, walking through those doors is not enough, but walking through those doors to make the necessary changes possible, it's what will get you better. And as doctors, sometimes we gotta be a little more flexible in terms of how we say stuff. Because sometimes what we say might seem glorious in our mind, but how it's interpreted might be completely different. Hope you enjoy the video. Maddie, I hate you right now, but going forward, the goal is to get to 4 or 5 and lose some weight. I'm gonna hold myself accountable. If there's anything you want me in terms of topics to bring up, please leave a comment. Until next time, goodbye guys. Thank you.